The vital role of radiation therapy to maximize cancer-free survival for women who choose breast conservation therapy, or BCT, is well known. Yet the most important decision for patients who qualify for BCT is to seek the advice of their physicians to choose a radiation oncology center and radiation delivery system that are capable of targeting the dose consistently, reliably, and reproducibly. With that in mind, Nucleotron introduces AccuBoost. Women with early-stage breast cancer increasingly choose breast conservation therapy. In the BCT option, the cancerous tumor is surgically removed in a procedure known as lumpectomy. To minimize the chances of the cancer recurrence, physicians recommend a course of follow-up treatment, which always include radiotherapy with or without chemotherapy and/or hormonal therapy. Part of this radiotherapy is a boost dose to the area at greatest risk, the margin of tissue at the edge of the surgical site.
The boost following whole breast radiation is really an important part of the treatment program for women undergoing breast conservation. Studies that came out of Europe showed that women that were treated with just whole breast radiation, 5 weeks of radiation, seemed to have a somewhat higher risk of recurrence than those women who had the boost added on after whole breast radiation. And we've argued in this country how best to do it, but I think the data has been pretty convincing, especially now with 20-year follow-up in those studies, that the boost is an important part of optimizing well control for breast cancer.
Now you can pinpoint and treat the lumpectomy site and protect a patient's healthy organs with AccuBoost, powered by Nucleotron, the revolutionary breast boost therapy system that combines mammographic image guidance using non-invasive high-dose rate brachytherapy to help physicians see what they are treating and treat what they see for better patient outcomes.
The boost is an important part of the program because it allows us to give a focused dose of energy to the site where the cancer started, which is the greatest risk for recurrence. So by raising the dose to this site, we're going to increase the chance that you'll never have a recurrence of breast cancer and will still have your breast 10 years after treatment.
So combination of non-invasive and image-guided radiotherapy, it has provided an excellent tool that physician can very precisely target the cavity inside the tumor, inside the breast, and treat that with a brachytherapy.
AccuBoost is designed to target and deliver the all-important boost dose accurately and reliably. The AccuBoost system is designed to take the guesswork out of daily patient positioning and dose targeting for the boost phase of the procedure. By using real-time image-guided radiation therapy, the AccuBoost system provides a simple, accurate method for accurate boost dose targeting. Furthermore, by sharing the same platform for imaging and applicator positioning, the AccuBoost system targets the dose precisely to where it needs to go and minimizes side effects of radiation.
AccuBoost is unique because it allows us to immobilize the breast and then deliver the boost therapy while imaging the area at risk. Outside of doing an invasive procedure, no other external measure of treatment would allow you to achieve what we so diligently search for in other areas of cancer treatment.
Typically it takes 15 to 20 minutes, so we can do one setup and treat both sides at the same time. And that has shortened the time quite a bit. Also using the higher activity source that make the time even less. So the faster, the more convenient for the patient. So in general, I would say 15 to 20 minutes overall treatment.
I actually was very comfortable with the AccuBoost procedure, and of course not knowing what to expect going into it. It had been explained to me that it would be similar to a mammogram, and I found that it was extremely comfortable. The technicians were very efficient in how they positioned me in the machine. And then the doctor took a look at the picture, and once the image was confirmed that they had the right positioning, the treatment itself was comfortable and quick.
Clinical studies show that delivering a boost dose results in significant reduction in local reoccurrence of cancer. Traditional electron boost therapy misses the tumor bed 50% of the time and exposes a portion of the underlying lung to ionizing radiation equivalent to 10,000 typical chest X-rays. AccuBoost targets the beam of radiation directly at the tumor bed and away from the chest, improving patient outcomes and significantly reducing the dose to the lungs and heart to less than 10% of the prescription dose.
Well, the traditional way of delivering a boost to the lumpectomy site as part of breast conservation therapy has been electron beam. And in the past, that's been set clinically by feel and hasn't been as precise as we would like it. And it's angled straight towards the lung, and on the left side is angled directly towards the heart. A lot of radiation oncologists will prescribe electrons and not realize that some of the beam exits right into the lung or the exits right into the heart. The AccuBoost, since it's parallel to the chest wall, angled away from the lung and the heart, will deliver much less lung and heart dose than a traditional electron beam.
Patients like AccuBoost because it gives them peace of mind. They're able to see the images, they're able to see the tumor bed, they can see exactly what applicator I'm using and what it's covering, and they know their tumor bed, they know where it needs to be targeted is what's being targeted accurately.
I had a very positive experience with AccuBoost. When I was first diagnosed with breast cancer, I was told I needed a lumpectomy, and following that, I was told, thankfully, that I did not need chemotherapy, but that I needed radiation treatment, and that I was a candidate for AccuBoost, given the location of the tumor bed. And I did some research of my own on AccuBoost and really got a comfort level with knowing that it would be targeting the spot where I had the lumpectomy.
Using special mammography paddles, the breast is imaged in real time to locate the lumpectomy cavity and identify the size and position of the dosing applicators. Non-invasive HDR applicators are positioned on the opposing sides of the breast to deliver a conformal radiation field directly to the target site, both in the craniocaudal and mediolateral positions. The dose accumulates in the target tissues where the horizontal and vertical treatments overlap, minimizing exposure to normal tissue.
AccuBoost is unique for two reasons. One is image guidance, meaning before each treatment we are able to image the breast and we know we're either targeting the tumor bed, we can see the changes, we can see the seroma, or we can see the clips. Either way, we can identify the tumor bed before each treatment. The other reason AccuBoost is very unique is immobilization. That's another thing we strive for. And generally we're talking immobilization in terms of patient, in this case, especially in women who have pendulous breasts, which happen to be most of our breast cancer patients. The breast can be moving during the treatment on a linear accelerator with the machine moving around them. And so in this, with the AccuBoost, when the breast is compressed in the mammographic plates, it helps keep them in the same position for the entire treatment.
The turnkey solution gives doctors everything they need to establish or expand their treatment program. The following are included in the AccuBoost program: mammography station and positioning paddles, computed radiography station to view and record real-time images, AccuBoost applicators in a variety of shapes and sizes for every patient's needs, microselectron digital afterloader to deliver the boost therapy to the breast and help treat many other body site cancers, complete installation and training, licensing, reimbursement coding, and customer service support, and pay-per-use financing. No upfront costs for the practice.
The implementation of the AccuBoost in our institution was pretty straightforward. Basically, if you have an HDR unit, you just need to get your mammography unit, which will be provided to you by the manufacturer, and the CR for imaging purpose. As far as the registration for state regulation, you need to register your mammography unit because it's an X-ray too. Other than that, the whole process is pretty straightforward, and we actually managed to do this in about a day and a half. We were pretty much done with the whole process.
I see several benefits to the Cancer Center in implementing AccuBoost. The first is a clinical benefit to the patient, reduction of skin dose and reduced volume of PTV, as well as peace of mind for the patient. They can literally see that the physician is treating the site where their cancer was removed, and it makes them feel comfortable that they're getting the best treatment possible. Additionally, there's a marketing benefit for the Cancer Center in having the latest and greatest boost technology available for patients in their community. Lastly, AccuBoost is an established, non-experimental procedure billed under existing reimbursement codes, making it financially sound for the Cancer Center.
AccuBoost has been used in the clinic for a relatively short period of time, and the progress that we've seen is outstanding. It's not unlikely that we will see some new developments in the use of AccuBoost, including perhaps partial breast irradiation, where the entire course of radiation is delivered using just the AccuBoost.
In the past, we focused just on survival as oncologists, and today we're focusing more and more on quality of life for the women we treat. We've come a long way. Survival rates have increased, and the rate of breast conservation has dramatically increased over the last 10 or 15 years. So I think that these new technologies, such as AccuBoost, will allow the woman to have the best looking breast, the best quality of life, while maintaining that survival rate that has improved over the last decade.
I think the future of AccuBoost and really breast cancer care is one of evolution. And if we look back into the early 70s when we started doing breast conservation, we started treating whole breast radiation, copying the surgeons doing a mastectomy. Harvard was one of the centers that developed the technique, and we've just continued doing that because it was working pretty well. We knew that there was minor risks of complications, but it was good enough. Until about 5 to 10 years ago, when we started looking at the idea behind partial breast radiation, really started us thinking, how can we improve what we're doing with breast cancer care? And that's when we've seen application of new technology. And I think AccuBoost is an outgrowth of that interest. It's allowing us the optimal way of imaging the breast, which is mammography, to now allow image guidance for treatment. And that really has significantly improved our ability to target and to really minimize the amount of normal tissue we're treating. So we can optimize the treatment of breast cancer while minimizing the toxicity of therapy. And that really is where we've been moving with all of oncology care, but particularly breast cancer care.
Through AccuBoost and their many other state-of-the-art radiotherapy solutions, Nucleotron continues to improve patient care and meet the evolving needs of patients, their caregivers, and healthcare professionals around the world. For 21st Century Health, I'm Corey Brand reporting.